So, first thing I just would like to do is really thank my family. My wife, Natalie, my 3 kids, Jamie, Joseph, and Jillian. I'm very blessed, and I'm a lucky man to have this wonderful family. Thank you. I want to thank everyone here, my colleagues, the specialty contractors, all the Nefecure families, the workers and supporters. It's just unbelievable. I want to thank my 400 Hunter Roberts families that have always been there working hard and supporting me in everything we do. And this construction industry that we have, it's extremely philanthropic. It's the best industry in the world, and you all have really shown your colors here tonight, and I want to thank every one of you for this tremendous support. This is truly overwhelming. So what I really want to do is share with all of you, why I really chose to help Nefecure, the campaign this year. And you may have read my letters. I know Michael mentioned them here. But I wrote to everybody to say really what this watershed event is here for Nefecure. So if we could put up here we go. Can you flip to the next one? So it's the A slide. Here we go. So here are the facts, right? The chronic kidney disease affects 20 million people. I heard a number of 30 million here, but it's 20 to 30 million people. Nephrotic syndrome is a rare form of CDK, and it affects 100,000 children and adults. There is no approved treatment or cure or treatment options. The path to solving this disease goes through these 100,000 patients. There's been a major change in the landscape. All the good work that Nefecure has done, they've changed legislation. If anyone knows the FDA and the government, you think about how long trials take, they take decades to get through. Well, this change is final, and it's the most critical part of the therapies. There's no placebos, this is actual drugs, and it goes right to the patients. So the most important thing that has to happen now is recruitment. There is, if you see the list, and there should be some at everyone's table that you can really see, there first went 4 big pharma companies that supported this. There's now 16. There's 16 different drugs that are out there in 2018 that needs to get tested. So why is this so critical? We can only be successful if these patients are connected to the new drug trials. The patient recruitment for this rare disease is a huge challenge. These 100,000 people and 100,000 docs are all over the country. The people have been struggling for decades, for 2 decades that Nefecure has been around to organize them and to communicate them. They have finally developed this Gateway program. The Gateway program requires funding to initiate it. I think the best example I can use is it's like these telemarketers, right? It's like one of these big firms that latch onto you and call you at your dinner hour and keep after you. Well, this system is going to be out there, and it is going to track the people. It's going to track the docs and track the patients and really get them to enroll. We need the patients to enroll, and we need this over the next 12 months. If we don't get behind this, Big Pharma will drop this, and we will not find a cure. That's why this is so important that it has to happen. So this Gateway program, it needs $1 million for the launch. It's extremely expensive, as anyone knows, if dealing with any kind of IT or software programs. So, as Michael mentioned here, we hit an $800,000 mark, so we're really asking people to step up and really support this. And most of all, I just want to thank everybody for giving so much, and just please, if we could just push this over the edge. This is extremely important, and it's for the kids, it's for the families, and for these patients. God bless you. Thank you.